Here's your host, Chelsea Edwards.
Welcome to another episode of Chat with Chelsea. I'm your daytime bestie, Chelsea Edwards. Today, we are shining a light on sickle cell disease. Now, this is the most common inherited blood disorder in the U.S., but a lot of us don't know a thing about it. So, today we are breaking it down, and we're going to chat about how it's affecting thousands of people every day. We have a woman here who says it's cost her jobs and even an engagement. Yeah, we're going to get into her story. You'll want to hear it. But first, we got to talk a little bit more about how sickle cell can make things, even ordinary things, difficult to do, like traveling.
I've flown all over the world with sickle cell. Let me show you how I do it. If you're watching this and you don't have sickle cell, you wouldn't know that the airplane is like a torture chamber for us. These are the 3 steps I use to survive these flights. First, I wear compression socks every flight. These socks apply pressure to keep my blood flowing really well. That way my sickle cells can't start clotting on me. Second, I focus on hydration. Now, coconut water is the best thing you can use to hydrate you, but they won't let you bring anything to the airport like that. So I use these hydration sticks. The more I can keep my body hydrated, the less likely I am to have any issues out of my sickle cells. Next, you always want to fly with a heating pad. I use this as a preventative measure. For me, my pain normally always starts in my lower back, so I put light heat on my lower back just to keep it calm. Do not use high heat. Always keep it light and only use it for about 20 minutes at a time. Don't keep it on consistently. Warriors, these are easy preventative steps that have kept me safe, and they can keep you safe too. Get out there and see the world.
Wow. Welcome to the show, Hawa Maswali, sickle cell warrior, I will call you. Okay, so there were a lot of tools and methods on there. Do you use any of those when you travel?
Oh, 100%. So I'm from Boston, of course. So I travel a lot from Houston to Boston. And when I tell you that heating pad is my best friend, people look at me like I'm crazy, but I'm not going anywhere without that heating blanket. When I'm in the hospital, that's what I use because unfortunately, you know, hospitals are extremely cold. So those are your best friend, especially when you find yourself dealing with lower back pain or pain that you can't really control too well, or you're waiting for medication to kick in. That is your best friend.
Okay, and you spend a lot of time in the hospitals.
Yes, unfortunately. So it's been quite the year for me. I mean, overall, entire life. But over the last year, I have found myself hospitalized at least 2 to 3 times every month since last May.
Wow, that is hard to imagine. I mean, and you're a mom.
Yeah.
So just thinking about the things that we already have to do as mothers, but you're having all these hospital visits on top of that. How would you explain sickle cell to someone who's never even heard of this disease before?
Okay, so for starters, so sickle cell is a blood disorder, and I think a lot of people forget that it's a genetic disorder, so you're born with it. It's not something that's developed over years. You know, some people do end up finding about their diagnosis over years to come, but you are born with it. So it is a blood disorder. I mean, the best way to kind of explain it is everyone has circular red blood cells, right? Us sickle cell warriors, we have crescent-shaped red blood cells. So when there's a lack of oxygen in our body, those red blood cells that are crescent-shaped clump together and prevent us from being able to have oxygen to circulate in our body and there to be proper blood flow. So that alone causes us to have a pain crisis. You know, a lot of us that have sickle cell also have asthma, so it gives us a hard time when we're dealing with our breathing. Our pain is excruciating. I have 2 kids. I've been in labor twice, and that is nothing compared to a sickle cell crisis. Yes.
Okay. Now, you described it as looking normal on the outside, but feeling like you have been hit by a bus.
Oh, yeah.
On the inside.
Oh, yeah, 100%.
So you can't do much of anything then if you're having a crisis. How often do these crises happen, or are they triggered by different things?
Yeah, so, I mean, various. So, I mean, I've seen a lot of changes in my life specifically because I'm used to colder climates. I'm from the East Coast and then moving to Houston where it's, hotter weather. So, crisis can be triggered by weather changes, when it's too hot and when it's too cold. A lot of people think it's just when it's too cold, but also when it's too hot because of dehydration. You can find yourself falling into a crisis if you are stressed out, which is something that I've experienced a lot lately. Wow. If you're dealing with maybe even the flu or something else that you're sick with, that can trigger a crisis. For us women, we find ourselves breaking into a crisis more frequently when we're on our menstrual cycle.
So how long does this last? Are you just, handicapped for a while? You can't do much of anything, go anywhere?
So for me, I found myself dealing with crisis. I could be in pain for an hour, right? But that hour feels like the worst hour of my life. Right? Some people find themselves experiencing a crisis for days at a time. So it may start on Monday and they may not find relief until Thursday, right? But then their pain comes and goes and comes and goes, But for me, it's more so it's instant. As soon as it comes, there's no waiting around. I need to get to an emergency room. Most times I'll try to manage by taking my at-home medication. If that does not work within 30 minutes, I am on my way to an emergency room because it gets to a point for me where I can't even breathe. And although this is, something where you can't see it, but in those moments, you can't physically walk because you're in so much pain. Sometimes you can't even physically breathe. And a lot of what gets, misconstrued by a lot of providers is that we're in so much pain that we may come off angry, right? Or, violent or, many different words that you can use around there. But we're in just a lot of pain. And a lot of people don't understand that, right? So we're going through this challenging time where we're just looking for some pain relief, and a lot of that can come off as anger.
Wow. Okay, so we're going to talk more about the difficulty in getting care and I guess keeping love in this situation. All right, we're going to take a quick break, guys. We'll be right back after this. 1 in 13 Black Americans carry the sickle cell trait, and it could leave them debilitated. But, a lot of folks just don't understand what's happening. You mentioned how, when you're in a sickle cell crisis, you can't really function. And you've dealt with this when you were engaged as well, like your partner not understanding what's happening.
I mean, it's super sticky, and I always tell my partners immediately, hey, I have sickle cell, I have sickle cell disease. So I give them the, the choice up front to decide if, hey, is this something that I can, deal with in a partner or not? And at the time, he said that this was something that he was fine with, and that, if I had a crisis, we would kind of work together during those times. Now, I had my son in 2022. And when I had my son, that was kind of the start of me having more challenging crisis. So when going through my postpartum period with my son, I started to find myself just getting a lot more sick, and when I would go to the hospital, a lot of the doctors would not understand what was going on, and unfortunately, in this specific state, the protocol is they just treat a sickle cell crisis, right? There's not too much that goes into it. The main thing is you go in and it's pain management. So they normally see what is, what you normally use for your pain relief, and that is the immediate thing that they provide to you, right? But unfortunately, that does not guarantee that that's going to break a crisis for you. So they normally have a limited amount of doses that they give you, and then based off of that, that determines if you'll be admitted or not. So there would be a lot of times where I'd be admitted because I could not find the relief that I needed when I would be hospitalized. And that turned into my partner not being there for me when I needed him to, right? There would be a lot of nights or days where I'd be hospitalized and I'd be alone, right? Now, what's the point of having this big ring on your finger when your partner's not there? Your doctors are asking you, your nurses are asking you, hey, do you have family? Where's your family? Can we is there a contact person for you? And you find yourself stumbling on your words, right? I always tell people that I may have sickle cell, but sickle cell does not have me. But in this moment, sickle cell was really playing a number in my life. And unfortunately, this person just was not there for me, And I would walk home into arguments after hospitalizations, and there would be times where he would think that, maybe I was faking a sickle cell crisis.
Wow,
and
I thought you were faking.
That was beyond me. I could not believe it, because like I said, the amount of pain that we go through is excruciating. Labor, in my opinion, is nothing compared to a crisis. And when the time came down to it, I brought the conversation up to my partner, and I basically told him how I felt, and his reasoning for it was, well, hey, I'm the breadwinner in the situation, and I'm doing my best to provide for our family, but what I wanted him to understand was sickle cell was playing such a big role in my life, and they don't realize how dark it gets when you're going through a crisis, You're in a lot of pain, and the one person that you're expecting to be there for you just isn't.
So you needed more support than he felt like he could provide through all of this.
Exactly.
Now, at one point, you were told that you were never going to be able to have children.
Yeah.
And now you have two.
And I have two, and I am so grateful to God because I had my stroke in 2017.
Was that caused by sickle cell, or
yes,
there was some?
It was caused by sickle
Okay.
cell. So I was going through various challenging times. I was a college student. I was stressed. I was very involved on campus, but unfortunately, I found myself getting really stressed with a whole new change of medications, and I think that's what may have caused the stroke. So after having the stroke, I was left unable to walk, unable to talk, unable to feed myself, unable to do anything for myself. And doctors told me that this is it. You know, there's not much that you can do. The best thing we can offer you right now is physical therapy, but your life is never going to be the same. And by hearing that, I lost faith in, you know, the idea of being a mother, the idea of being able to achieve certain goals that I had set for myself. But I just always would tell myself that, you know, God is in control, and I just could not accept no. I couldn't accept no for an answer because I just know how powerful God is and the role that God has played in my life. And so I persevered. I worked with various providers in the New England area there, more specifically Yale Hospital, and they were able to provide me with a lot of resources to be able to overcome my sickle cell and, you know, provide me in a position where I would be able to manage my sickle cell a little better to be able to conceive. And now I've been blessed with two little ones.
Wow, that is so good to hear. I mean, even with all the challenges you continue to go through, you do feel like you've overcome it and you are managing very well. At some point in your life, with all the crises that you were experiencing, it was hard to, you know, just have a regular job. But now you're an entrepreneur. I've heard entrepreneurs work all the time.
Oh, yeah.
So how are you managing all this?
So to be 100% transparent, when my sickle cell started to get really bad for me last year, I had to make the executive decision to walk away from my 9-to-5. I work in healthcare, and unfortunately, you can't take care of other people if you can't take care of yourself. And so I had to make that decision for myself, and I stopped working in February of this year. And I have specifically focused on being an entrepreneur. So I am an Airbnb host. I was able to launch actually one of my Airbnbs when I was in labor with my daughter.
Wow.
And I do credit repair. I also help apartment locate for those interested. I started a charm bracelet business, or a custom jewelry business that allowed me to kind of get off of the stresses that sickle cell was bringing me during my admissions, and, you know, the idea of feeling lonely during those times. So I just kept myself busy. It's not easy. Doctors, nurses would look at me like I'm crazy, like this girl is always here with her laptop, she's working, she needs to be resting. And I'm sitting there like, no, I have a goal to achieve. I have a goal to achieve, because I just want to be part of the population that's able to say that, you know what, yes, I have sickle cell, but I am going to push through this.
Wow. Well, thank you for allowing us to witness your strength, and for inspiring others out there dealing with this or trying to learn more about it. You have really helped some people out today.
Thank
you so much. You guys, we're going to take a quick break. After this, we're going to hear more about how sickle cell can even affect your teeth. Be right back. Sickle cell can affect every part of a person's life, including their health in their mouth, right? Yes. We got Dr. Jean Morency and Linda Chandler and Kitty Alfred here from the Potter Smile to tell us all about this. So what is it that people don't really know when it comes to sickle cell and dental work, I guess?
Well, most people know and think that sickle cell is just a blood disease, but your teeth also have blood that goes through it. And if there's not blood going to the tooth will die. It will lead to abscess, infection, and toothache. So just like someone who has sickle cell will have kidney problem, joint problem, or spleen problem, because like the guest before us said, the blood clump together and prevent the blood from going to the organ it's supposed to be going. And the tooth is also a small organ, because each tooth has blood going through it, it's got nerve going through it. And if it's not receiving oxygen and nutrient, it will die just like any other organ, and then you will have tooth problem.
Wow. So Potter Smile, you all help people with these issues, and you also raise awareness about this. How did Potter Smile get started?
Well, it actually started about 50 years ago. When I was at the University of Texas Dental School getting my degree in dental hygiene. We were not educated on sickle cell disease at all. And fortunately for me, my pediatrician was a sickle cell. He was a hematologist for sickle cell. So that's where my knowledge of it came about. And then when my mother died from actual sickle cell disease, we did not know she had sickle cell disease until 2 days before she died.
Wow.
That was another awareness, but in the dental field, we're not taught anything about it. We weren't given any, they didn't lecture us at all. So as I learned more about it, I started looking at the clinical manifestations in sickle cell disease, and I decided that something needed to be done. So that's when we started looking at the dental side of it, and what better person to have as a potter is Dr. Morency, who is also a Harvard graduate and one of the top 10 prosthetic dentists, to reconstruct these mouths for the sickle cell patients.
Wow, there seems to really be a lack in the medical industry when it comes to training on sickle cell. Why is that, or why do you think that is?
Well, for a number of reasons. Number one, I call sickle cell the forgotten disease, because even in medical school, you only have maybe about an hour, one lecture on sickle cell. In dental school, you don't have that at all. It's just mentioned in passing by.
Oh, wow.
As a result, because sickle cell does not affect the general population, mostly African American, or actually throughout the world, people of African descent, it is not as recognized as, let's say, cystic fibrosis, for example, or polio or something like that. So professionals, like we speak a lot throughout the United States, we give lectures to doctors, dentists, and sometimes we have audiences of 60, 90 people, and of those 90 people, maybe one of them may have heard of sickle cell.
One?
Maybe out of 90, sometimes
Yes.
one
Out of
them.
all these professionals.
Yes, yes.
And you actually also go around the globe with this as well.
Yes.
Yes, yes.
Okay, tell us about that work.
That's
Well, that's basically where I come in and where Kitty comes in, because what we do is we actually book seminars, we book lectures, and people are actually coming to us now for the information, because a lot of the dentists don't know anything about sickle cell disease. What we're finding out as we lecture the dentists on the clinical manifestations, we're finding out that a large group of the people don't even know their sickle cell status.
Wow. Okay, so you all help with that as well?
Yes, and another thing that we found out is that a lot of the sickle cell societies became dormant, especially during COVID. So we are now reaching out to different sickle cell societies. We went to Tallahassee to go and work with them, because once again, they had been dormant for a long time, and so they were able to start back. They did like big parades, and they would give out seminars. So they invited us to come in and do a seminar to the sickle cell population. And we met a lady and a young girl that had sickle cell, and just to be able to educate people, because like he said, so many people have no idea about sickle cell, and especially on the dental side. So we like reaching out to the different societies in different states. Even though we're local, we try and reach out all over globally.
So what does it look like if someone comes to your office, they don't know that they have sickle cell disease? Are there certain giveaways that will lead you to test them for that?
Yes, you can tell by the x-rays, the specific pattern, the bone pattern when you on the x-ray. You can tell by whether or not you're missing some teeth. There's very typical of a sickle cell patient missing 2 molars on the bottom, down the bottom jaw. That is that's a telltale.
Oh, wow.
Of sickle cell. And also, the most important thing is, when you do have a sickle cell patient come into your office, there are certain precautions that you have to follow, because you may hurt them, not just in pain, but in sickle cell term, more than you help them. There are some medicine you cannot use because, for example, in dentistry specifically, sometimes when you numb somebody, you want the numbness to stay there for a long time. So the medicine that you use causes the blood vessel to constrict, get very small. But that's the same thing sickle cell does. So If the blood vessel is already clogged up and you give a medicine to make it more constricted, then you create a problem at the end organ.
Wow. So there is training needed
There
for
is training
this.
needed,
Definitely.
definitely. You got to be very careful. Yes, ma'am.
And so people can come to your office in Houston. I know you get people from all over, but you all do these sickle cell Saturdays where people can come in for treatment?
Yes.
Right.
Yes.
So we've been doing them here on Fridays.
Okay.
And it's when you come in, sickle cell patients, and that's like one of our big fundraiser things that we want to do, and we do, so that Dr. Marinsky is able to treat those patients, and we do it free of charge. He's able to come in, you get your x-rays, he give you an examination, and as much work if he's able to on that day, he'll give you the service for your dental care.
Wow.
So that's our big thing right there, is being able to help somebody that's less fortunate to get the dental work.
All right. Well, thank you, Potter, Doc, for all the work that you do, reconstructing and helping rebuild people's smiles, and you ladies as well. We mentioned y'all do events, you fundraise to make this happen. I know you guys got an event happening. Where can people find out more about the designer bag bingo that y'all have coming up?
If they would look on our website, we're at www.thepotter with an S, smile with an S, so .org.
Okay.
ThePottersmile.org.
ThePottersmile.org. Okay, I will be there. Okay, we're going to have a good time, you guys.
Yes.
All right, we're going to take a quick break, and we'll be right back after this. Before we go, we want to spotlight Kisa Kisa handbags created by designer and sickle cell warrior Kisa Williams. Each design actually represents a sickle cell turning into a healthy one. So what a way to transform her journey into something beautiful. Thank you guys so much for watching this episode. Please keep up with us on social at Chelsea Show Fox, and we'll see you on the next Chatting with Chelsea.